Hello, I'm Erica, a student at Michigan State, and I'm here today with Michigan Vaccine Project and Dr. Josh Myerson to discuss vaccination information for college students like myself. First, we have a short clip about two students' experience with meningitis.
Our child, Nick, in a period of hours, he went from a healthy, vibrant young man to being brain dead.
Once you get meningitis, you really can't fix it. It's too late. You might live, you might die. Who knows? I didn't know what it was, and it destroyed me physically and mentally, emotionally, in every aspect possible. We had no clue. I didn't know anything about meningitis. Nothing.
As I understand it, is a disease that can attack the brain, the spinal cord, or different body parts. And it's been proven that when you live in close proximity, the potential of contracting meningitis is a lot greater. We got the A&M, he was a junior, and it was unbelievable how many people responded to that kid and how many people absolutely loved it.
Nicholas was a loving person, very kind, and he had a contagious smile.
You don't realize how important siblings are until they're not there anymore.
I received a phone call at work, and they told me that Nicholas was in the hospital.
It was only 8 minutes after he was admitted that he went unconscious.
All we could do was hold his hand, kiss him, pray for him, and hope that he would come out. The doctors gave us hope. We're not going to count him out, so let's just pray, and that's what we did. But Nicholas never came out of it.
We wanted to give it time, give God time to work a miracle, and that's what it was going to be. And we gave it a few days, but unfortunately that miracle never came.
Being at UT, I had parties I wanted to go to Thursday night, Friday night, and Saturday night. But I got sick on a Wednesday night. My body did emergency shut down. One day you're fine, and the next day you're dealing with serious decisions. My limbs were turning to black because my body cut down circulation because it was protecting its organs. And just being in an immense amount of pain. I dealt with my limbs being amputated. I came out and I put my life on hold and I stopped and I had to learn how to live again. If I had gotten vaccinated, I would not be dealing with my nightmare.
Nobody thinks that anything terrible is going to happen to me or my family. But when it does strike, it is so devastating.
Not getting vaccinated in my brother's case meant death. It seems like another routine, another errand that you have to do. But if you don't get the vaccine for meningitis, you are literally putting yourself at risk to die. It's a shot. And that's it. They gave me a shot in my arm and it lasted for 2 seconds and I was done. Prevent what's preventable. Get vaccinated.
Get vaccinated.
Please get vaccinated.
All right, meningitis rates are the highest in young adults, such as college students. Could you elaborate more on meningitis and what students could do to protect themselves?
Yeah, sure, Erica. First off, I should introduce myself. My name is Dr. Josh Myerson, and I'm currently the medical director at 3 local health departments in northern Michigan, in the northwest, the northeast part of the Lower Peninsula, and the Benzie Leelanau District Health Department. My background is pediatrics. I'm board certified in pediatrics, and personally, I have one child who just finished college, and I have my youngest son, who is currently in college here in the state of Michigan. This is something that I've been thinking about for my own family and is important to me professionally and also personally for my family. We just saw the meningitis can be a very serious illness and have serious long-term consequences. And there are actually several strains of the meningococcal bacteria that can cause illness. And there's 4 of those strains are in one type of meningitis vaccine, the conjugate vaccine. And that vaccine is routinely given at 11 years of age and a second dose at age 16. And then there's another type of meningococcal vaccine that people call it MenB or meningococcal B because it's the B strain that it protects against. And that's routinely offered at age 16. That one also requires 2 doses a few months apart to complete that series and provide full protection. And for people, if you're going off to college, especially if you're living in dorms, communal living spaces, I recommend that students get both of those meningococcal vaccines prior to entering school.
All right. Moving forward to the Q&A portion now. The first question is, other than, as we mentioned, the meningitis, are there other vaccines recommended for new college students that are moving into dorms?
Yeah, many vaccines are recommended. College is a time where people spend a lot of time with groups of people, often in small spaces, lounges, and dorm rooms. They may live in dorms or other communal living arrangements. There's communal dining rooms that can be crowded. And all of those activities put them at increased risk for many different communicable and vaccine preventable diseases. Things like measles, mumps, chickenpox, whooping cough, the meningitis, meningococcal disease like we talked about. But they can also have increased risk for exposure to other things as well, like the hepatitis viruses, hepatitis A and hepatitis B, as well as HPV, the human papilloma virus.
Okay. Are any of those vaccines different than what is recommended for other 18-year-olds?
Really, they aren't for the most part. All of these vaccines are part of the routine vaccine schedules. In theory, when you're going off to college, a young adult or adolescent, if they received all of the recommended vaccines according to the routine schedules as a child and adolescent, they're generally going to be all set before they go off to school. The MenB vaccine that we talked about isn't usually started again until age 16. So that is often the last vaccine that adolescents or young adults get before going off to school. But again, whether they're required by a school or not, these are all vaccines that are universally recommended for adolescents and young adults. And I think it's important to note that these recommendations come from several national academies that represent pediatricians, family doctors, and doctors for adults as well. And they come out recommended by the advisory committee that advises the Centers for Disease Control, the CDC, and that's where these immunization schedules come from. So they're fully approved, and that's done so after rigorous scientific study that has shown them to be safe, and over many years of use and millions of doses, that they're not just safe, but they have a proven track record of being effective at preventing serious illness from many of these different diseases.
Other than the recommended, like on schedule vaccines, are there any optional ones that young adults might want to receive?
I think, yes, there's a few I think that might be good mentioning. HPV, the human papilloma, in my mind, that's not really optional. It's just as highly recommended as all the others, but it wasn't one of the ones that may have been required for entry to middle school or school here in the state of Michigan. And because of that, less than half of young adults have completed their HPV series, because they just never received them even throughout their adolescence. To remind people, HPV is a virus that causes genital warts and cancers. It can affect both males and females. It can lead to cancers, not just of the cervix, but also penile cancer, anal cancer, and cancers of the head and neck, of the throat. PV virus is so common that most of us are exposed to at least one strain, there's several, by the age of 16. So we routinely recommend the vaccine at age 11. But again, as I said, there's many young adults who haven't received or completed this series of HPV vaccine that protects against 9 of these strains that are commonly associated with cancer and other issues. So I think it's important when a young adult turns 18, they should recognize that they can make their own decisions about their health. And I urge them to be informed about the risk for HPV and what they can do to reduce the risk of cancers and other conditions related to this very common infection. HPV vaccine, again, is about preventing cancer, and the best time to get it is before you may be exposed. Other optional vaccines, Erica, one is hepatitis A. I like to mention that. Hepatitis A vaccine is now routinely given to young children starting at age 1, but many young adults didn't receive this because it wasn't routinely recommended when they were young children. Hepatitis A is a virus that spread easily from contaminated food, person to person, and it's an infection that leads to inflammation of the liver, hence the term hepatitis, and that usually leads to things like abdominal pain, nausea, vomiting. You can get jaundice where your eyes and your skin turn yellow. It can be serious and require hospitalization for supportive care. There's no specific treatment for it. And hepatitis A vaccine is really effective, and it provides long-term protection against hepatitis A. And this is something you can be exposed to during outbreaks from those that you live with or work with, or from contaminated foods, either from a local source, from a local farm, but also associated with large outbreaks from food you might buy at your major chains and supermarkets. And it's also one you definitely want to get if you're considering or thinking about doing international travel as part of your studies.
Great. So clearly there's a lot of recommended vaccines. Are there any required for attending college?
That's a good question too, Erica. Some states require certain vaccines for attending college. There are, I think, about 34 states in the District of Columbia that have a requirement either for the hepatitis B vaccine or for meningococcal vaccines for college attendance. That's something, depending on where you're going, to check what requirements you have. And then probably more commonly than that is many private colleges have their own requirements that can include several of the recommended vaccines. There are always going to be vaccines that are recommended, but they may require that you be up to date with vaccines against measles and mumps, the meningococcal vaccines, chickenpox, tetanus, polio, and others as well.
Our next question is, when should students get vaccines like the flu shot or the COVID-19 shot? And would over a holiday break be a good time, or during school? Just what is a good time?
Yeah, that's a good question. Those are two important vaccines we haven't talked about yet. Influenza, the flu shot, is definitely recommended. Everyone every year should get an updated seasonal flu vaccine. Those are usually given in the fall. Generally, September and October is the best time to get the flu shot. So it might be difficult for people to get before they go off to school. And although you can get it in Thanksgiving or over the winter break, if you didn't receive it beforehand, it's one of those that you may want to try and get while you're in college. The flu comes around every year. And if you're in college, you're going to be around a lot of people, especially if you're in dorms and other crowded buildings. And that's just going to make infection more likely for students. And I think the last thing that you need is to fall behind in classes and schoolwork or miss out on things because you're in bed for 5 days with the flu feeling miserable. This is a vaccine you may want to look at trying to get while you're in school. COVID is also another illness that you're likely to be exposed to in school. The pandemic is over, it ended, but COVID didn't go away. We had a pretty sizable bump in COVID activity just this last month over the summer, but I expect that we'll see a bigger bump in the winter when respiratory viruses like COVID spread more easily. I think it's important to remember most all of us have some prior immunity to COVID because we've been vaccinated and or we've had COVID, perhaps even multiple times. But this prior immunity from past infections can wane enough so that people can continue to get sick from COVID really multiple times in every year. So there is an updated COVID vaccine that's coming out very soon this fall. and it can provide additional protection and reduce your risk of getting a severe case of COVID. So just like the flu, this is a vaccine that I recommend, especially for people who may be more likely to expose because they're going to be in college, living in dorms, and really more especially for students who may have underlying conditions that increase their risk of severe or moderate disease. So students who have things like asthma or diabetes or many other medical conditions that might put them at increased risk, they really should consider getting that even more.
Where should students go on a typical campus to receive these vaccines?
Yeah, good question. I just said you should think about getting a flu vaccine while you're there, and you might not know because you're in a new town and you're not used to having to search out access to things for your health. I always say that your primary care provider is a good place to start if they happen to be nearby or while you're at home before going to school or perhaps over a short break. That's always a good place to start. But most colleges and universities have student health centers. Many of them are going to offer most, if not all, the vaccines that you may need. They may also offer other services that might benefit you, and it would be good for you to be familiar with what offerings you have at your student health center. Another spot would be local pharmacies. A lot of the pharmacies now offer many of the vaccines and can offer a pretty convenient way to get the vaccines that you need. I think another place I want people to think about is your local health department. Every county has a health department in Michigan, so there's probably a local health department office either in the city or nearby your campus, wherever it is that you may be attending school. In Michigan, pretty much all local health departments will provide any of the recommended vaccines. And so those are good places to think about going to as well. I might be a little biased working at local health departments, but I think they're very good at providing reliable information on which vaccines you might need. And they're also able to give them to you generally pretty quickly and get you on your way because it's simply a vaccine visit. It's not a full healthcare visit. I think another important thing for people to know is that usually if you have insurance is going to cover the entire cost of all the recommended vaccines for the most part. So there really shouldn't be out-of-pocket costs for you. You shouldn't have to worry about that. If there is, or if you're uninsured, the local health department, again, is a good resource because it can provide most all of these vaccines at no or very little cost through different government programs that are available for people who need those to make sure they can get the vaccines that they need.
Great. So I'm a pre-med student, so I've had to go to my health center to receive flu shots or TB testing for shadowing and volunteering. Are there any other recommended vaccines for other specific areas of study, such as pre-vet or education?
Yeah, that's a good question. Certainly, your occupational risk can change the recommendations or even the requirements for the types of vaccines that you need. To start, healthcare students like med students, but also students who may be studying physical therapy, occupational therapy, people training in the emergency medical services, paramedics, nursing students, PA students, or medical students, they all need to be protected from several infectious diseases for their own health because they are more likely to be exposed to sick people. But it's also an issue of patient safety, so that they will not be exposing patients to these illnesses while they're working. And in general, students in healthcare, all those different healthcare fields, they need to really have protection and be immune to things like measles and mumps that you get in the MMR vaccine, chickenpox, the varicella vaccine, hepatitis B, which you can be exposed to through blood or body fluid contact, as well as the yearly flu vaccine, as you mentioned. They should also be up to date with their tetanus and whooping cough, the Tdap vaccine, which protects against tetanus, diphtheria, and pertussis, which is whooping cough. Education, teachers, there aren't necessarily requirements, but teachers are exposed to a lot of sick kids. The teachers will tell you people in education, the first few years are going to catch more than their fair share of colds and things that they're exposed to. So as a teacher or someone in the school system, I would want to be up to date with all the recommended vaccines, and especially the seasonal vaccines, the seasonal respiratory vaccines. Veterinary students are a little different. Their exposure to animals, and so they're fairly unique in that often it's required or just strongly recommended that they're immunized against rabies, which is somewhat unique to that field. But rabies vaccination is a specific thing, and often that requires a trip to the local health department to get that.
If a student is planning to study abroad, are there any other vaccines they should be considering?
Yeah, definitely. I know a lot of students think about that, and many do go off and study abroad. It can depend on where you're going. Are you going to a developing country, or are you going to a fully developed nation, perhaps in Western Europe? So it depends on where you're going. But for a lot of travel, not just for study abroad, but also they're taking spring break vacations or vacations where they're volunteering, doing mission work, or help in international aid work in developing countries, especially. Hepatitis A vaccine that we talk about is really recommended for most people for travel reasons, because it's much more common in the developing world, and you can be exposed through the food you eat as well as the water that you drink. Other vaccines you might need, again, just depending on where you're going, are things like the yellow fever vaccine or the typhoid vaccine. You may also need medications to protect you against malaria, and get information on how to also protect yourself from other diseases that we don't see here that you may be exposed to. And a good place to go to get information about travel is the Center for Disease Control. They have a travel website that really has complete information for people. You can enter exactly what country or region you're going to, and they can give you a lot of information. And that's just cdc.gov/travel, and a lot of good information there. I think the other important thing for people, if they're thinking about going abroad, is you want to be up to date with all your recommended vaccines that you need in this country too before you leave, because it can be hard to access those if you are traveling. If you leave this country, your health insurance isn't going to work quite as well. So if you get a cut or a wound while you're out in a different country and you need a tetanus booster because you didn't get a tetanus booster before you left, it might be difficult for you to access there. So make sure you're up to date with your recommended vaccines too.
Great. And this is our final question. Where can college students locate their vaccine records if they just don't know how to find them, or they haven't had to before?
Yeah, that's a good question too. Again, a lot as you're going off to college, for many individuals, many students, this is going to be the first time where they need to start taking a little more responsibility for their own health, and they may or may not know what vaccines they've received. And this is a good time to have a copy of your immunization records, because you may need to provide that to someone. If you got a lot of your vaccines at your doctor, you have a pediatrician or a family doctor you went to, they should be able to get a copy for you. But I also like for students here in Michigan who grew up here, if they received their immunizations in Michigan, they should know about our immunization registry, MICR, the Michigan Care Improvement Registry. That is statewide immunization registry that should have all the records of the immunizations they received in the state of Michigan. If they receive vaccines out of state, they can be entered in. They may or may not be there depending on if their provider has put in that historical information. MICR has a patient portal, so individuals can access that. And I think you can maybe share some links to that about how to access your immunization information in MICR. You can also go to a local health department who can help you and even print out an immunization record for you if you aren't able to do that yourself, again, or contacting your doctor's office.
Great. That's all we have for the webinar today. Thank you so much for joining us. This is very helpful.
Super. Thank you. It's been my pleasure. And thank you for having me today, Erica.
Thank you, Dr. Myerson.